Hey everyone, in this video we are going to be talking about topical application and how you use oils when applied topically. Topical application is a wonderful way to use essential oils. It provides about 30% bioavailability to the body of the oil, and what that means is that here we have the epidermis of our skin, the outer layer of our skin, and beneath that we have the dermis. And the dermis layer is actually filled with lots of teeny blood vessels that are bringing oxygen and nutrients to our cells. So anything that we put on our skin does get systemic absorption. This is a really important point that I want to make about anything that you put on your body. I like to say that if you wouldn't eat it, you should not put it on your body because you are getting systemic effect from that, and you're absorbing those chemicals and whatever else that you put onto your skin into your bloodstream. So topical application with oils is great if you're having any sort of skin eruption, from a blemish to a bug bite to a scratch, a scrape. I don't always like to put them into open wounds. You want to make sure there is a little bit of a scab on the wound, but oils can be wonderful for any skin disruptions that you have, as well as anti-aging, great for topical application. What I want to talk about that's important is how we dilute oils for topical application. One of the greatest ways that you can apply oils is with one of these little roller bottles. And doTERRA actually makes these wonderful lines called Lavender Touch. Any oil that says touch on it means that it's pre-diluted in a roller bottle for you to apply topically. So if you were going to not use a roller bottle, what you could do is just actually take some fractionated coconut oil, put it in your the palm of your hand, and actually put 1 to 2 drops of oil. A good rule of thumb is about 1 to 2 drops per teaspoon for adults, 1 to 2 drops per tablespoon for really babies. Once your kids are getting to that age of 5, 6, you can probably use that lower level dilution for them. You just want to be careful with hot oils such as oregano, cinnamon, cassia, clove. Those you always want to heavily dilute. So topical application, like I said, is a wonderful way to use them for skin eruptions, but another way that we use them topically is to get that systemic absorption. And a great place that we love to apply them is on the bottom of the feet. And there's a couple of reasons for this. There's some literature out there that says the pores on our feet are bigger and that we absorb better through that, and you get 15-second systemic absorption by applying oils there. Some of that has been refuted, but you know, other things that I have read have said that that's the main reason. But one reason to use the feet, number one, it keeps it away from, especially our kids, their hands and fingers. We don't want to always put it on their hands and fingers because then they touch their eyes or their mouth, and we don't want that. But the foot is a very sensitive area on the body, and it's actually been mapped out with a lot of different reflex and pressure points on there that connect to different areas of our body. So it's a wonderful way to kind of apply the oils for systemic effect as well as for relaxation too. So that's a great place to apply them topically. Another great place to apply them topically in young children is actually along the spine. Remember, we don't want their hands and fingers near the oils because we know like they'd love to touch their eyes and mouths. So I love to apply it on my children's spine because I know that they can't get to it back there, and they're going to have some good systemic absorption from that topical application. I love to apply oils topically for my face and in my facial beauty regimen. Lots of great oils that are wonderful for topical application for skin issues that we're having. So lots of different ways that we can use oils topically, and you can still use them for emotional aromatherapy topically. I love to, when I'm having tension, use my past tense blend on my temples, wherever I'm feeling the pain. Obviously, if I have muscle pain or tension, I'm using it topically there. If I'm having stomach discomfort, I'm going to actually apply the oil there. If I'm having monthly female discomforts, I'm going to apply the oil in that area. So a good rule of thumb is wherever you're having the discomfort to actually apply the oil in that place where you're having the discomfort. If you guys have any other questions about topical application use of oils, please put them in the comment section below the video. Hope you enjoyed this one. We'll see you on the next one.